Good morning, everybody. This is exciting. It's a really nice crowd. I'm Molly Irwin. I'm the Chief Evaluation Officer at the Department of Labor. I have the pleasure of moderating this great panel. Welcome to the panel entitled The Impact of Different Approaches to Providing Job Search Services to Low-Income Job Searchers. As you guys all know, this panel is going to look at recent developments in job search assistance programs, and we have 3 different presentations today. The first is going to be by Jacob Klerman, who's going to really give us sort of an overview and talk about different pathways or different theories of change for job search programs. And then we're going to be followed by 2 presentations that are going to talk about a recent impact evaluation of a job search assistance program in New York City that used 2 different approaches, and we're going to have both the perspective from a researcher who's going to present the findings and then a practitioner perspective. And before we move into those, I'm going to tell you a little bit more about our 3 presenters. I'm going to introduce them all right now in a row and then turn it right over to them to go through the presentations. We've saved a lot of time for questions at the end, so be thinking as we're going through, both those of you in the room and those of you watching live, about questions. Those who are watching live can type questions in, and we will, as I said, have lots of time for them at the end. So the first presentation is going to be by Jacob Klerman, who is a senior associate and senior fellow at Apt Associates. He's a senior evaluation methodologist who specializes in the assessment of U.S. policies and programs that address labor market policy and nutrition policy. Specifically, he's the lead in a number of different random assignment studies of major labor market interventions with funding from a number of different federal agencies. He's been very involved in the impact evaluation of job search strategies with ACF, and also the impact evaluation of the REA program at DOL, and will weave lessons from both of those into the talk that he gives. He's going to be followed by Karin Martinson, who's a principal associate at Apt Associates. She's the project director for the Job Search Assistance Strategies Evaluation and has 25 years of experience in policy-related evaluation on a wide range of programs and policies that affect low-income individuals. And she's conducted multifaceted, large-scale evaluations on a range of employment strategies and has authored multiple publications related to those. And then finally, Kinsey, Dinan is the Deputy Commissioner for Evaluation and Research in the New York City Department of Social Services. There she serves as the administrative structure for the New York City Human Resource Administration and the Department of Homeless Services. Together, these agencies administer a wide range of programs that serve the city's low-income families. The Office of Evaluation and Research there informs decision-making across these program areas through internal implementation and impact evaluations, primary research projects, policy analysis, and the office is responsible for coordinating external research and evaluation efforts involving agency, data, clients, and staff. So with that, turn your attention first to Jacob, and we will walk through the presentations.
See if I can get the technology right. Oh, actually works. Good. Good morning. I was thinking about starting by saying that job search assistance seems to be an area of policy with increasing attention, with some change in the administration, and I'm looking at the size of the crowd in the room and thinking that maybe I'm not the only one who thinks that way. So what I want to do this morning is I want to give a very broad, high-level overview of ways to think about job search assistance. I want to think about the theory of action, the evidence for that theory of action. Most of my examples are going to be drawn from the unemployment insurance area, though I think it'll become clear in the presentation that I give that many of the ideas carry over directly to TANF. Okay, so with that, let's go forward. I have a relatively conventional talk. I'm going to give you a rather in-depth discussion of theory of action. I'm going to talk about the evidence and how I think it relates to what I said about the theory of action. And then I have some discussion at the end about some implications of those findings going forward. And I hope that it's a nice setup for the presentations that follow. Okay, so let me begin with a standard disclaimer. As Molly said, I've been working on this area for a while. I co-led a design effort which became the study that Karin and Kinsey are working on. And I'm currently the internal app reviewer for that. And in addition, I'm working on a very large evaluation of these issues for the Department of Labor. And I'm supposed to talk about some of the stuff that's in the public domain and not the stuff that's not in the public domain. And Molly is my contract officer, so I will be extremely careful. So the standard disclaimer applies. While the work that's here, what I'm going to talk about builds on prior funded work from the Department of Labor and from OPRE, what I'm going to say only reflects my opinions, and in some cases it may be that others disagree. And maybe people in the room will disagree also, and that would be great. So we'll go from there. Okay, so let's talk about theory of action. Okay, so when we think about job search assistance programs, in this case, we want to think about them in the context of benefit programs. So that would mean TANF, unemployment insurance, general assistance, SSDI. And if the administration gets its way, soon also in an expanded form, SNAP and Medicaid. Okay, so that's the context. So it's important to remember that what's going on here in these programs is that we have a disjunction, a contradiction between conflicting goals of the program and the participant. The program wants people to leave quickly because it would save money. And often we literally have program goals about cutting caseloads. That's certainly true in TANF. And ideally, the program would also like people to be employed and to employed well. A few of us are misogynists. We don't like our cases. We'd like them to get jobs. That's the best way for things to come out. The relative emphasis on people leaving, on the jobs they get and the quality they get depends on the program and the specific people implementing the program. So participants have goals also. Participants in general would like to leave also. Most of our participants would like to work. But the standards of what is a job that is good enough that it would make them leave are often higher than the standards that we have as the program. The programs often have the attitude you should take any job that's out there, and the participant would often say, no, I think that I should search a little bit longer, maybe I can get a slightly better job. From my perspective, it's better not to take that job and to stay on the program a little bit longer. And that means that the two things are butting at heads, or maybe better that they pull away from each other. And so trying to meet those two contradictory goals is a challenge for programs that in this situation. And the economic theory and the general approach says that one way to get at that tension is to run job search assistance programs. The goal of these programs is not only to provide assistance, but more than providing assistance, the goals of these programs of the job search assistance programs is to implement the broader goals of the underlying program. That is, get off this program for some job, not necessarily the job that you want to hold out for. And so that's among the things that the programs are trying to do. Okay, now the programs do that through 3 complementary pathways, and the 3 complementary pathways have different implications for what outcomes we would expect to see. Okay, so the first one is the first pathway is the pathway that is implicit in the name that we give these programs, JSA, Job Search Assistance, and it constitutes much of what our caseworkers actually do. We try and help people to find jobs. We sit down, the caseworkers sit down one-on-one with the clients and put together a job search plan or reemployment plan. We give them classes in putting together resumes or help them put resumes. We give them classes in sitting in job search strategies, in how to do an interview. We give them specific job leads, maybe through job developers. And if that method works, it will push down the caseload because people will get employed faster. When they get employed, they leave the program. It will push up short-term earnings because they go from our program to work. So in the program period they would have been on the program, they have higher earnings. And if we really succeed in helping them to search for better jobs, and to find better jobs, then they will actually have higher earnings well after the program might have ended, because we get them jobs that are more appropriate for them, that they can stay in, that have higher pay. So that's win-win-win all around. Okay. The second way that job search assistance works, and frankly the way that many job search assistance programs work in practice, is that they say you have a requirement to search for a job. And we are going to make sure that you fulfill that requirement. And we'll see examples of that in the presentation that Karin and Kinsey are about to give, where the program actually requires that and the New York City program requires that you show How many jobs did you search for? You come into the office and demonstrate those things. And we can think about among the things that job search assistance programs do is that they enforce a requirement that you are actually searching for work. They make that requirement quantitative. You must make 3 job contacts. You must check in every morning with us. And then through that, they increase the intensity of job search. We're not helping you to search for better jobs. We're just saying, don't sit at home, go out and search for a job. So if that program works, it'll drive down the caseload, you'll get a job, and then you'll leave the program. It'll drive up short-term earnings because you got the job, so your earnings, you're replacing time on the caseload with earnings. It's unlikely to have an effect on long-term earnings because you're not searching any better. In fact, it's likely to push you into not searching long enough, and it may actually push your long-term earnings down because you're not finding as good a job as you might find otherwise. Okay, and the third possibility, the third pathway is what I like to call an ordeal. And the word is deliberately dramatic. So we simply require that people come into the office, maybe once a week, maybe once a month, maybe every day. And that's one of the reasons why they do that is because we want to make you miserable. So miserable that you'll want to leave the program, that working is better than staying on this dang program. I hate my caseworker, going to work is better. And I like to remind people that many of us work in nice air-conditioned offices, and we work with charming people. I get to work with Karin. But the low-wage labor market is not always so charming. Bosses aren't so nice. The offices aren't always air-conditioned. And so making receipt of benefits worse than working is a challenge, and one of the ways we do that is by making people on the caseload miserable, just by making them do things that aren't useful but make things worse. And when you do that, you can drive people off the program, especially if you require that people do it and penalize them if they don't. That will drive the caseload down. Whether it will increase earnings depends on whether you drive them off the caseload, they get a job. Sometimes they do, sometimes they don't, and it's unlikely to have any impact on long-term earnings. So those are 3 different pathways, and they are very different. And when we think about our job search assistance programs, we want to ask, to what extent are we emphasizing each one of these 3 pathways? Everybody's good so far? Nod your head, good. It's the professor and me coming out. So what I want to point out here is that at least in the UI context, this idea of ordeal is incredibly powerful. So what follows is a very simple simulation that's based roughly on the data that we presented in the implementation study for the REA report. So if the REA program only requires you come in for 1 meeting. So in the experience that we have, about half the people come in when they're supposed to come in. About half the people come in not the first time when you cut their benefits, and then they say, oh, you really want me to come in? They come in next week. And about a quarter of the people do that, and that's late, coming in late, and about a quarter of the people never come in at all. That's the experience in the REA program. It's not exact, but it gives me nice clean numbers for the simulation I'm about to show you. Okay? So in general, if you came in on time, you get no penalty at all. If you come in a week late in the REA program, you should get penalized for the week you didn't come in. You lose a week of benefits. And if you never come in, you would have been you would have collected for 4 or 5 more weeks. Let's just say 5 weeks, because the numbers work out nicely. So like I like to say, I learned calculus. I don't know a lot about arithmetic anymore, but I think I can follow this one. So there's no penalty for the people who came in on time. A quarter of the people came in a week late. That ends up being a quarter of a week in terms of the impact of the program. The people who came, a quarter of the people never come in, they get 5 weeks of penalties. That comes out to be a week and a quarter. If you add it up, you get 1.5 weeks. Just from strictly enforcing the requirement to come into the program, knowing that many people won't. Now, this is important because we will soon see estimates of the effects of job search assistance programs in UI, and those estimates suggest that the impacts are in the range of half a week to 2 weeks. That is, the estimates are of the same order of magnitude or smaller than what we would get if you strictly enforce the requirement to simply come in. Does everybody understand that? So when we think about job search assistance programs, we want to think carefully about whether or not we are making the ordeal work, whether we want to make it work, and whether or not that is what's causing all of the impacts that we see. Okay, so this discussion suggests that understanding the actual pathways is important, so let's talk about the pathways that we observe. Okay, so here's the evidence. So what I want to do here is I pulled out the old DOL studies of job search assistance. These studies pulled out, you can interpret these studies as separately testing enforcement or separately testing assistance. Now, they all have an ordeal requirement because you got assistant enforcement, you had to come into a meeting. If you had assistance, you had to come in for a meeting. But when you look at this separately, the overall picture here is that when you have more enforcement, you get large impacts, somewhere about half a week to a week. And when you have assistance, you get smaller impacts, often under a quarter of a week. And the larger impacts of enforcement are when it was, of assistance was when there was assistance without enforcement, so that the fact that you got assistance required you to come in. And I read these numbers as saying that there are large effects of enforcement, or at least the ordeal of being required to come in, and the evidence that assistance works on cutting the caseload is mixed, at least in the UI case. Okay, on the other hand, when looking at earnings, some of the assistance programs actually help people to get larger jobs, several quarters out. So there's a trade-off here between pushing people off the caseload, pushing the caseload down, and getting people larger earnings. Okay, people are clear about that? Okay, I'm going to skip. There's more recent evidence. I'm going to skip this so I'm on time, and I'm going to give you the discussion. Okay, so the lesson I want to give you here is that there is clear evidence that enforcement and ordeal cuts UI durations. And I think it's true in other programs as well. If your goal is to keep people off the program, what you want to do is to hold people's feet to the fire. There's a version of the report on this stuff that says the mantra that you have should be triple S. You want your penalties for not coming in to be sure, swift, and substantial. And if you do that, you can get large cuts in the caseload. Whether you will get large improvements in employment outcomes is a totally different story. Assistance, there is evidence that assistance will get you improvements in labor market outcomes, but much smaller impacts on the caseload, so you have to choose about which outcome it is you're interested in. Okay? But even so, there is evidence that the increase in employment is smaller than the decrease in the caseload. That is that a lot of the people who are pushing off of the caseload are not getting jobs. And that's, you want to look at the pair of things together. Looking alone at whether or not people are being pushed off the caseload is one thing, but asking whether they're actually getting jobs is something else. Both pieces are important to look at. Okay. And I guess the bottom line for me is that I think that we want to assume until proved otherwise that the impacts that we are getting on caseloads are due to the ordeal, just a requirement of people bringing people in, and I think that it requires more evidence to conclude that we're really helping people in terms of assistance. We spend a lot of money on the assistance part, but the evidence that the assistance is working is mixed. And let me finish with the standard plea of researchers, send more money. Not really. There's actually a lot more results on exactly these questions coming very soon. And we will know a lot more about how job search assistance works and the magnitudes, the impacts, and the pathways through which to work. First, in the next 30 seconds, the rest of my panelists will talk about results we have today for New York City from the APT ACF Job Search Strategies Evaluation. And if I understand correctly, they will have results from Sacramento and Michigan in the fall of 2018 and the spring of 2019. And the DOL APT REA Impact Study, which I'm running, along with at least one other person in the room, is extremely large. We randomized over 250,000 people in Indiana, New York, Washington, and Wisconsin. And we specifically randomized some people to a pure control group. They got no assistance. We randomized some people to an enforcement where was mostly an ordeal. And we randomized some people to get enforcement with the ordeal plus assistance. So this evaluation is just specifically designed to get at the incremental effect of assistance above and beyond the ordeal and enforcement. And we will have results on that, supposedly according to the schedule, to be publicly released in spring of 2019, about a year from now. Thank you very much. Look forward to the comments.
Great. Hello, everyone. So where are my slides?
There you go.
Thank you, Jacob, for providing that context for this study. And I think it's important to be thinking about those dimensions as I go through this. As Jacob said, I'm going to present what we're calling relative impacts of two different approaches to job search that were implemented in New York City. It's part of a study that we're doing for ACF with Mathematical called the Job Search Assistance Strategies Evaluation. So I just want to take a quick second to thank everyone. This is a big project. It's definitely a team effort. There's a lot of co-authors on this report that is just coming out. This is actually the first time we're presenting the results. And Ellie Harvell is in the audience. She's a co-author. Also want to shout out to Russ Sykes, who helped us recruit sites for this study and was really instrumental in launching this site in New York City. But finally, Kinsey, who you're going to hear from next, was a great partner on this project. Doing a random assignment in welfare offices in New York City is not the easiest thing, but Kinsey made it happen. And it's great to be on a panel where I haven't really done this too much over the years, where you get to really get the reaction of the program that you're evaluating real time. So this is the first time Kinsey's really, they just came out really a couple weeks ago, so it's all very new. So what I'm going to do today is just do a quick overview of the policy and research context and why we launched this study, talk about the design specifically in New York City, and go through the impact results, and then kind of have the conclusions. We really have a lot to cover in a short time, so I'm going to move pretty quickly through the results and not cover every result, but we will have time to discuss things if you have questions. So as you know, TANF requires non-exempt welfare recipients to participate in a specified set of work activities, including job search assistance as a condition of receipt. And some states and localities also require cash assistant applicants to participate in job search before their case is approved. These are sometimes known as divergent programs, and the goal of these programs is to help people get jobs to avoid going on assistance. So New York City has had a job search applicant program for several years. So just that's important to know. The past studies on job search as part of welfare to work programs, as Jacob alluded to, has primarily shown increases in employment through finding jobs faster. Didn't really lead to finding better jobs or increased earnings. However, many of the studies are dated, and a lot of questions remained, and there's actually very few studies of applicant job search. So because of these open questions, ACF funded this job search assistance strategies evaluation. And the evaluation is taking place in 3 sites where we're conducting both an impact study to randomly assign individuals to different approaches and compare their employment earnings and public benefit receipt, and then an implementation study to document the program operations and service delivery. So each site is really a separate evaluation, and New York is the first results that we have. So in New York, we're comparing 2 programs. I'm going to come back to the description in a minute, but they're called Back to Work. New York calls it BT2W, right? And Independent Job Search, which is IJS. So it's important to note that this is a differential impact study. That's what the economists like to call it. We don't have a no service control group. So we're really just comparing 2 programs to each other. So one thing, because to interpret the study, it's kind of important to know how the job search fits into the cash assistance application process in New York City. And just to let you know a little bit how it works, is when you come in to apply for assistance, you do it at a job center run by HRA. And if you're non-exempt, like if you're not ill or incapacitated, you're referred to a vendor to participate in 4 to 6 weeks of job search as a condition of getting your case approved. And you have to do that job search to get your case approved. And it's during this 4 to 6 week period where your case is being processed. And then once you're approved, you continue you also have to continue to meet work requirements as part of the TANF program. So our study really focuses on the first 4 to 6 week period where people are getting job search assistance. And then after that, they continue in the same program. So what we're doing in this study is comparing 2 programs. So as I said, one is called Back to Work, and it requires 35 hours a week of participation in job search activities. And the key is at the program office every day. You have to go in every day and meet with your staff person, and it's a full-time commitment, 9 to 4. Most of the activities are, you fulfill the requirement by participating in activities at the vendor office, which includes a wide range of job search classes. You have a case manager, they have job developers that are out, working with employers to identify openings. You can spend some time going to interviews, but the key is that you're supposed to be there every day. In contrast, independent job search requires 35 hours a week of participation, but with no restrictions on the location or how you fulfill this 35 hours, but you do have to come in weekly to meet with your case manager. So it's really a weekly requirement versus a daily requirement. But the IJS group, you can participate in any group classes or anything available at the vendor, you're just not required to do so. So why did we undertake this study? And Kinsey will talk a little bit more about this, but HRA was interested in kind of developing something for job-ready cash assistance applicants. So this is actually really a subgroup of all cash assistance applicants. That's something that was less intensive, potentially less costly, but might have the same effects on employment and earnings. And I think because they'd been running Back to Work for several years, they were interested in whether moving away from kind of a one-size-fits-all approach to something that might be a little more individualized. And because the applicants were job-ready, it was envisioned that they may need less assistance than other types of applicants. So how did we do this study? So we enrolled 2,700 TANF and safety net cash assistant applicants. So there's a lot of different little pieces to this project, but in New York, they not only have TANF, but they have a safety net program that serves childless adults and people who have reached their 5-year time limit. So we have both these groups coming through the program, and both of them were included in the study. So then those that are job ready are randomly assigned to one of 2 groups. One is the Back to Work program that requires the 35 hours with daily attendance, and one is the independent job search program that requires weekly attendance. So the programs were relatively short in duration and called for immediate job placement. So we look at, we're going to compare the outcomes of these 2 groups over a 6-month period, and we are looking at the job search services they received, and then how that affected their employment and earnings, and how it affected their benefit receipt. And we use administrative records for earnings and benefit receipt, and we also have a 6-month follow-up survey of participants, so we have both a survey and administrative data. So what did we find? Finally, I'll get to some results. First, we looked at whether there were any differences in the receipt of job search assistance services between the 2 groups. We would expect any differences in service receipts to really drive the impacts on employment and public benefit receipt. So we examined participation in job search during the early weeks after random assignment, and this aligns with the 4 to 6 week period where applicants were looking for work and their applications were being processed. And this information comes from our survey that we conducted. And the red bars show the Back to Work program, and the gray bars, the IJS program. The impact is the number above. That's the difference between the 2 programs. And then there's stars to indicate statistical significance. And all the charts are going to follow this graphic, so just wanted to take a second to explain that. So first we see in the first graph is that participation in job search services was high for both the groups. We have 88% in back to work and 85% in IJS participated in job search, but it was a statistically significant difference with back to work slightly higher. We also see that those assigned to back to work participated for more hours per week and were more likely to participate in group and one-on-one activities compared to those in IJS. Given back to work's more rigorous attendance requirement, this is not exactly surprising, but those in back to work participated 21 hours per week on average compared to 19 hours for back to work, or for IJS. And that includes actually zeros for people who did not participate, so it's an average. And then there were differences, 82% of back to work participated in one-on-one meetings and 78% of the IJS group. And then we also see differences in the group job search. I think one thing to also take away, and I'm going to come back to this, is that the IJS group is doing stuff. And you see like half of them went to group job search class, even though they didn't have to. So, okay. So we also looked at what topics were covered in the job search assistance services. And we looked at kind of what we defined as 2 competencies, such as how to fill out an application, kind of hard job search skills, interviewing techniques. And then we also looked at kind of softer skills, workplace behaviors, helping problem solving, kind of things that might help you do a better job on the job. So here we see that more individuals assigned to back to work received assistance with both these competencies. I don't really have time to go through all these, but you can see kind of the specific areas. We're seeing small but statistically significant increases in all these areas. And we also see the same thing for the workplace behavior and soft skills, where the back to work group received more assistance in these range of areas. And this, I think, is really consistent with that more people in the back to work programs went to the group job search activities, where these activities were more consistently covered. So let's turn to the employment outcomes. So we had a confirmatory impact measure, and this is a measure that we pre-selected to identify whether one program was superior to the other. And here we're using employed in the second quarter after random assignment, which is really the 6-month follow-up period that I talked about. So here we see no differences in employment between the 2 groups, with 2/3 in about each group being employed 6 months after random assignment. But we also looked at earnings. I'm just going to leave out this middle column for now. But we do detect a small increase in earnings of $429. It's a small amount, but it is statistically significant, and it is an 8% increase. So the back to work group earned more on average than the IJS group. We also had these results for an earlier cohort that had a year of follow-up. So we do have, it's 72% of the sample, and we actually see the same pattern with no impacts on employment, but small increases in earnings. So now I'll turn to the public benefit impacts. So we looked at acceptance and denial rates for cash assistance. And as you recall, applicants had to meet the participation requirement to have their case approved. And one could hypothesize, as Jacob alluded to, that this would lead to higher denial rates among back to work because of the more onerous requirements. And indeed, this is what we do see with IJS having a higher approval rate. It's 58% compared to 51%. And more rejections, which is the second column, due to failure to meet requirements. Here, the 32% of the back to work group compared to 25% of the IJS group were denied assistance because they did not meet requirements. So this led to lower TANF, both receipt rates and benefit amounts, which is kind of the third and fifth bars there. So we do see lower assistance rates among the back to work group. And we also looked at SNAP. So SNAP was not tied to the participation requirement, but we also see statistically significant reductions in SNAP among the back to work group. This could be that people didn't follow through with their application, SNAP application when their TANF was denied. And it also could be due to the increased earnings. So we can't exactly sort out, because both for the TANF and SNAP, there are increases in earnings that could also drive the benefit reduction as well as the participation requirement. So this is my last slide. Good thing I have 1 minute. So I didn't go through a lot of the implementation study because of time, but I just wanted to, on the implementation study, we found that both programs are really strongly implemented. The participation requirement was strongly enforced. The vendors do really provide a very robust set of job search services. The group job search classes are very substantive and rigorous. The job developers are really quite an impressive group. So I think the services were strong sets of services. But I think it is important to note that the IGS group participated more than required. So that's something also to keep in mind when you implement these requirements. So overall, we see more cash assistance rejections due to failure to meet application requirements, lower cash and SNAP receipt rates, and lower benefit amounts, no change in employment, and slightly higher earnings. So it's kind of, what do you make of all this? One thing is that the differences are small, and that's important to keep in mind. And we are comparing two programs, so that's one reason why we see small results. There's it's one program against another. But I think, as Jacob talked about, this really does indicate that there's trade-offs in terms of what you want to achieve. This has always been the case with TANF. It wants to, work requirements. It's there to establish a quid pro quo. It's there to increase employment and also reduce cash assistance. But sometimes these goals are in conflict with each other. I think here, back to work could be a more attractive option. It reduced the cash assistance expenditures, but it also increased earnings. However, it is a more expensive program, and the results it's produced are small. So I think that's something to weigh. We actually thought a benefit cost study would be interesting in this study in particular. And I think also, though, there's concerns that back to work reduced TANF and SNAP without increasing employment. And it does raise some concerns about how families are supporting themselves. But I think it'll be great to hear from Kinsey about what she thinks. And that's why it's great that she's going to go right now. So thank you. Does it start automatically?
Hi, everyone. Thanks so much for being here. This is really exciting to be on this panel, and this has been a really exciting project, and we're excited to be looking at the results now. So I'm going to talk about our local agency's perspective on being a site for this rigorous evaluation of job search assistance. As Karin noted, in fall of 2015, we collaborated with Apt Associates in launching this one-year pilot. It was implemented in 4 sites, 4 employment services sites in New York City, 2 in Queens and 2 in Brooklyn. And it served our applicants in the cash assistance program, both TANF and Safety Net. I'm going to talk a little bit about implementing the study and what that experience was like, and then some early thoughts about what we've learned. So first, why did we participate? We participated, first and foremost, because we had a question, and that question was, could our most job-ready cash assistance applicants benefit from more autonomy in their job search process? So as Karin noted, our applicants are required to participate in job search as a condition of applying for cash assistance. And those requirements are generally understood to operate in both of the ways discussed. So both reducing program entry through job attachment, and also reducing entry through increasing compliance-related rejections. And sometimes it's hard for us to tell the difference because when someone gets a job, they may or may not report that to us, and they may simply stop attending our program, and those will get recorded as a compliance-related rejection. So it can be difficult from the data to distinguish the mechanisms, but we think both are at play. At the time of this pilot implementation, we had a new administration that was very interested in moving away from a focus from a fairly one-size-fits-all approach for our job-ready applicants and clients, and looking at more tailored ways of serving our clients. And so we were interested in this study as a way of testing a potential option for clients that appeared well-suited to it. I'm going to not talk about the two models because Karin discussed those in a lot of detail. Karin also discussed the impact metrics, but just to say a little bit about our agency's perspective on them. So obviously our goals are to increase employment and earnings. We also are interested in seeing the cash assistance impact, but here we really have goals in both directions. So we want to reduce the need for cash assistance through employment. On the other hand, we also want to reduce compliance-related rejections for those who don't have employment. So we want to make sure that people's needs are met and that eligible applicants receive our services. And then I want to say a little bit about implementing random assignment because we really worked with APT and with teams in the agency to integrate random assignment into our business processes, into our IT systems, so that all of our clients, when they start their first day at their employment services provider, they complete an employment plan. The pilot eligibility assessment was built right into that employment plan, pulling on some of the questions already in the assessment, adding additional questions that we needed for our screen. The system in the back end then determined eligibility in real time, and then also for those eligible, scan to see if there had been a prior random assignment for that individual, because over the course of the year of recruitment, we did have people, of course, apply multiple times. And those who were not previously random assigned, the system triggered the informed consent process and all of the related documents kind of appeared. And those who consented were then automatically assigned, randomly assigned into one of the two models with implications for the back-end timekeeping requirements. So we'll talk a little more about that lift in a bit. As we said, we're targeting our most job-ready clients. So we define that for these purposes as clients who came in with either an associate's degree or more, so are higher educated applicants, or had current part-time employment or very recent employment. And in addition to either having higher educational attainment or recent employment, clients were screened based on a response to questions about their self-perceived readiness to look for and start a job. With that, out of 16,000 applicant employment plans completed at our pilot sites over the course of a year, just under 30% were assessed as pilot eligible, and of those, 56% consented to participate in the study, leading to the sample sizes Karin mentioned. We've got 1,300 in each group. Of those, just under a third qualified by having an associate's degree or more. Okay, so why did we want to participate in this study? As I said, we had a question, and a number of different voices in the agency were really interested in a rigorous answer, both certainly in the evaluation and research shop where I work, as well as in the program area and in the leadership of the agency. And I think particularly when you're expecting kind of modest results, quasi-experimental evaluation methods that might have been more feasible to do on our own really don't provide the clarity that you need. And by collaborating with APT in this nationally supported study, we are really able to focus multiple departments, and that's what it took to really to implement this rigorous random assignment evaluation. We received financial support and technical assistance for integrating random assignment into our processes and into our IT systems. APT also, and this was very important, really brought expanded capacity for the collection of research data that help us understand our clients' perspectives and experiences. And so we saw the results of the survey that really provide a new insight to us, data that we don't have right now about what clients do when they're in their activities and in their assignments. There was a background information forum and a lot of site visits, and we're looking forward to seeing more from that in the full report. And finally, I'll say that the New York City Department of Social Services and Human Resources Administration, for a long time, really pride ourselves on being data-driven, on drawing on the evidence to best serve our clients. And so I think we were all very excited to be part of this national effort to build evidence in this area. So the challenges. First, it was a huge time commitment from a lot of different agency departments. So the Office of Legal Affairs, just the data sharing agreements and so on up front, right? The IT systems and all the work they did on the back end. Our HR and working with our staff and providers about new ways of doing business. Obviously, the Family and Dependents Administration that runs the Cash Assistance Program, the Office of Evaluation and Research, and the Office of Planning and Performance Management that pulled large amounts of data and pulled it into kind of rational data sets to provide to APT associates for analysis. So, and it was also a burden on our providers to implement the consent process and to simultaneously manage two different models of job search assistance. It also brought an external scrutiny to the implementation of a really complex process, and in a lot of ways, that was a benefit, and really, as I say, kept us focused and really provided conditions that supported this taking place. But I think also, that can be a challenge for all of us involved on the agency side. We are really excited in the coming months to think more about the implications of this work. We are in the process of, or we have launched and are implementing a new career services approach for cash assistance applicants and clients in New York City. In spring 2017, so just after this pilot wrapped up, the Back to Work program was replaced by 3 sets of contracts that are designed to support a more individualized, tailored approach to services. So that's Career Compass, Career Advance, and Youth Advance. These services are complemented by a range of engagement options, education and training, subsidized employment, community service, and independent job search. And we are really excited to use the process and impact findings from this pilot as we seek to really understand how to best match our clients to the services that are most appropriate and will help them the most. I'm going to say a few things about our very preliminary agency reactions to these results that Karin shared with you all today. We saw those same results just really a couple weeks ago, so we've only started talking to the program areas and the agency leadership about them. But I think that on initial glance, I think it provides support, or we think it provides support for their current policy of offering independent job search as an option for applicants and clients who appear most job ready. First, the survey results do indicate relatively high levels of voluntary participation in job search assistance among the applicants in IJS, and I think that's important because there was some concern about kind of cutting folks off from assistance who maybe could benefit from it. We also saw that rejections for cash assistance due to non-compliance fell, leading to higher rates of public benefit receipt, but with no measurable impact on employment rates. So that's really important for us and suggests that we are maybe seeing a reduction in rejections among those who really need the benefits. Although again, I'll caution that when people are rejected for compliance, we really don't know much about their employment situation. And it also, I think that there was also the negative impact on earnings, which I think, could be an area of concern, and we do want to hear more about that and see more about what we can learn in the full report about the patterns in that. On the other hand, it is also possible that increased public benefit receipt reduce the pressure to increase earnings quickly, and it could support a kind of better job matching outcome, as Jacob was alluding to in his discussion of the ways that different levers can affect folks, and that is really a big priority of the current administration, to prioritize job matching over quick attachment. And finally, I'll just say that it really demonstrates to me, and I think to my program area colleagues, the value of developing systems that will provide our agency with more detail about client activities and engagement, service receipt, while they're in contracted career services provider assignments. And this is something that we do have a vision for doing, but it may be a little bit ways off, but really understanding how many and which clients are engaging in different types of assistance will be important to understanding how to serve our clients better going forward. And then I'm just going to end by saying that we are all really interested and looking forward to seeing the full report and discussing the findings internally and with our partners, and thinking through in more depth how they can inform our work. Thank you.
Are these on? So we have about 20 minutes for questions, so folks should come up to the microphone and ask questions, and we will start with Laura.
Hello, everyone. I'm Laura Peck from Apt Associates, and I don't entirely have a question. I just have a comment and a compliment. One of the things that I think has given experimental evaluations a bad reputation in the field of practitioners is that they often require that we randomize people to an excluded group, and program managers don't like to do that. Even in the spirit of learning. And so I think the examples that you provided today are really helpful models for us to think about how we can leverage really high quality designs and learn something about how programs can improve, right? So you're looking at alternative models, JSA versus independent job search, and in the REA example that you provided, Jacob, sort of a how do we parse out the relative contributions of assistance versus enforcement, and what I call the hassle factor. I forget what you called it. Anyway, so I think that that's something that I wanted to call out to this audience, because I do think we have lots of practitioners in the audience, and we can be thinking about how to use high-quality experimental evaluation designs integrated in a way that doesn't mean you have to turn people away, but that instead you can test alternative models and figure out really what it is that we should be doing to improve program effectiveness.
I think that's good. I have to say, even though this was a differential test, there were some concerns about the IJS group. I'm looking at Erica there. ACF had, there was some concern that they would not get adequate services. So we had to address that even in this situation.
Hi, I'm Candace from Colorado, and we have counties who have looked at doing different tracks for people who are job ready, and it's always that question of, but when you get down to then operationalizing, what does that mean for job ready? So often there's no actual definition of that, right? It depends on if the case manager thinks they're job ready. So I really like that about this, that there were some there were variables that you had to have. Can you go into that a little bit more? Can you remind us what those are? Because I'm just thinking about bringing this back and suggesting that counties actually use those specific factors.
Sure, and obviously you're right, there's definitely no clear way to define that, and a lot of the markers are kind of, generally speaking, is at the discretion of caseworkers and at their opinion of who's job ready. I think for this, obviously we needed to come up with criteria, and I have in the audience folks who were really engaged in figuring that out a few years ago now. I think not that many of our clients have a higher education, and so having an associate's degree or more really does kind of set folks apart. And I think there really was a sense that in a program that's designed to serve kind of everybody who is employable without limitations in the program, it's going to kind of serve the majority, and the folks with the higher education might not be best suited to it. So I think we were particularly interested in that group. And then I think folks, you know, again, this is people applying for cash assistance. A lot of people are coming in, they've just been employed, and kind of thinking that that was a marker as well. And we did look in the data too and find that those two groups both had higher job placement, notably higher job placement results in sort of our past data. And so we knew that those characteristics were associated with higher rates of job attainment. So that was, you know, evidence that they were more job ready, indicators of being more job ready. And then we looked at the literature. We did want to get at this idea, like, do you really think that there's jobs there for you, that you could get those jobs and that you could start a job tomorrow? Because we hear a lot of people coming in that in general want to be employed, but maybe they just feel like, of course I want a job, but like right now I'm getting evicted, I've got, you know, like these, so they're not ready at that moment. And so we wanted to address that as well. And so that was just a self-perceived, self-reported answer, but we felt it was important. I will say that most people answered that in the direction that indicated job readiness, but definitely not everyone. And so we were glad to have those folks participate in the regular program.
In the existing employment, that's for if they, I'm sorry, so they're employed when they came in?
Some folks come in with part-time employment. More of the employment was recent employments, but some folks do come in with very part-time employment. Really, I would say that's mostly the family cases, right? A single adult with part-time employment probably isn't going to come into the program, but sometimes a parent will. And there too, I think the flexibility of a once weekly quick check-in versus a full-time commitment. I mean, if you're part-time employed, you do get those hours off, but it still can be difficult to manage both of those things. So I think for that population, we anecdotally heard that it was actually particularly of value.
Next question.
Good morning. I'm Larry Timmerman from Ramsey County, Minnesota, and I think Kinsey may have just answered part of my question. But what I'm wondering is, with your robust sample, first of all, excellent work. I know how complicated this can be and how challenging sometimes. Were you able to break out any demographics, age of children, race, ethnicity, or even geography, distance to those centers?
So we are just kind of wrapping things up, or just, we just kind of done the basic analysis. So the one thing we did was looked at people with children versus people that didn't have children to kind of get at the TANF safety net issue, because we couldn't tell which program they were in. And the impacts were very similar for the TANF and safety net groups. And I think we are thinking of doing some additional subgroup analyses, but Kinsey has looked at some of the, one thing about New York is they run their own impacts. Was looking at was interested in kind of the education level, and so I think that's something we might look at in the future.
Do you have a conjecture? Is there something that you think might be worth looking at?
Two things. One on geography. Did distance to where they had to go to participate matter in terms of the outcomes? And another one, we found in another study that parents with children who are older, their youngest child who's older, are more able to participate in more rigorous programs. And so I'm wondering if you found that in that large study.
And one thing that we were in, I didn't mention this, we were only in Brooklyn and Queens, not only, but I mean, so people, and we had 4 offices within Brooklyn and Queens. So people, you know, New York, you could generally get to your vendor office because of the subway system. So New York is kind of a unique setting, I think, just because the transportation issues are more about getting to work. We found, like, on the survey that people's barriers to work, that transportation kind of surprised me. It was their number one barrier, but I think it's more getting to jobs rather than, because their vendors are in local communities.
Thank you.
Hi, great work. I'm Russ Sykes with APHSA. have a couple of questions, Kinsey, particularly for you. I mean, would you say, Jacob described, would you say that the back-to-work population went through more of an ordeal than the independent job? Yeah. So when you look at the relative results, I mean, it's sort of ratified, I think, where you approached this from the beginning, which was certain people were well situated to take care of themselves, and even though they had to comply to some lesser degree, they were able to meet expectations almost in the same fashion as the others, and so that's one. And is that a fair thing to say from the assumption here?
Right, I think it was a couple things, that they might be better suited to their own, to more autonomy in running their own job search, and I think also a concern that perhaps the program might a little bit more serve the middle in trying to, best serve the caseload that they have at hand, and so the population that was maybe a little more at the edge might be a good population to think about another model.
Okay. And my only other question, maybe you didn't even study this, were you able to separate any opinions about your vendors from any of the study about their approach? I mean, I won't name them, but I know who they were. I don't.
These are both great providers.
Now, we didn't really look at, we didn't look at, we had, I mean, they're in the report, America Works and Goodwill. So,
Right.
we didn't look at performance by vendor. I mean, there were some differences in the group job search activities, kind of the way they did that, but I'm not sure at this level whether they mattered. I mean, I was thinking about Jacob's comment about whether it's an ordeal, and I would say that both vendors tried to make it a positive experience. Like, they were definitely trying to help people get jobs and do the assistance piece. They were not trying to make it an ordeal. I mean, they were very, as I said, robust services. So.
On the other hand, it is a lot of hours.
It is a lot of hours, right?
Yeah.
But the staff themselves were trying to be positive, I would say.
Well, it's great. I think it'll be really useful. Can't wait to see the full report, too. Thanks.
So following up on that, I wonder, I mean, if I'm reading this right, when I look at it, the number of hours between back to work and IJS is not that different. Mm-hmm. So I wonder if in the implementation study, if you captured any of the differences of what folks were getting in the offices versus what they were able to do at home. And I wonder if we know anything about not just intensity, but also quality, especially in an environment where folks can get more and more stuff at home or at the public library.
Right, I think we heard that, I think staff had more of a relationship with the back to work group, and I think they felt they got to know them more and kind of, I mean, it's kind of maybe not what we were thinking in terms of individualized services, but I think it's particularly the job developers, like there's, each vendor had a set of job developers that really just spent full time finding jobs, making matches, and if someone came in every day and said, I'm looking for a job in X, they would really be going out and trying to find that job. So I think that kind of service, just because you were there every day, was higher quality than, I think not higher quality, but you just kind of, and I think the case manager said also they just had a stronger relationship with the back to work group because they came in every day and they knew what was going on with them. So, whereas I think the IJS group tended to just kind of drop in, go to a job search class, use the computer lab. But I think staff also reported that some of the IJS group was around more than they thought they were going to be. Mm-hmm.
Good morning. My name is Stephanie Bass. I'm with Fairfax County Department of Housing, and I work for the Family Self-Sufficiency Program. Thank you so much for your work, and thank you for sharing it with us today. As a practitioner, I was curious to hear a little bit more about the qualitative data that you are collecting, and in considering quality of life for the participants in terms of the two programs, what those two programs offered in terms of that.
In terms of, sorry, quality, like
Quality
what their outcomes were?
outcomes for quality of life in terms of what they got from the back to work program and what their quality of life was, maybe in terms of the independent.
Well, so we didn't look at a lot of like overall well-being measures, but I would say for both groups, the earnings remain really low. So, and not that different. So I think, earnings were $7,000 around for both groups. The average wage of the jobs people were getting were just over $10 an hour in both groups. And we found that the increase in earnings was due to primarily an increase in hours, not an increase in wages, and that the jobs, I think less than half had health insurance. So I think I'm not sure they really changed. It remains a group that is still, has barriers to employment and
Right. Well, I
issues.
think in light of that research, I was interested in the qualitative information you're getting from the client surveys in terms of, did the independent program offer them more flexibility? They didn't have to pay for daycare. And the back to work program, maybe they got something out of the cohort that improved their emotional well-being, that type of information.
We don't have, I guess we don't have anything specifically on that. I mean, I think in both groups, we kind of focus more on employment issues, but both groups, reported high motivation to work, high, a positive experience with the program. So, but we didn't really, I don't probably have a good answer to your question, sorry. But maybe.
And well, I don't have an answer to that question either, but I did want to mention that in terms of childcare, we do guarantee childcare assistance to cover the cost with no family share for all cash assistance applicants and clients who are engaged in work activities, and that included both the back to work and IJS folks. And if you don't have your childcare in place, you can delay and not start your assignment until that's done, and we help you with that process. So I just wanted to put that out there.
Hi, Angela Rashidi, American Enterprise Institute. I was surprised by the high level of service receipt among the IJS group, so I'm curious where those data come from. Is it self-report? And then also, if it was self-report, or the services received or provided by the back-to-work provider, or could it have been services that they received somewhere else, or just that they did on their own? And then just a quick follow-up to that is, if there was an hour requirement on the IJS participants, would they have felt any pressure to report certain hours, given that they felt that that was a requirement?
Right, so the survey, it was reported on the survey, so it's self-reported. And so I think it could be anywhere. We just asked, did you receive any job search assistance services? But I think, and just from what we heard from the staff, I think the fact that they came to the Back to Work program and they saw the services there, and they knew they could access them. I mean, and some of them could have been in Back to Work earlier, so some of them had knowledge of the program. So we don't have any evidence, specific evidence, but it appears that most went back to the vendor, although they could have gone to a one-stop center or something else as well. And then what was the requirement to report? I mean, we don't have a lot of information on that. I think an IJS, I think the workers just kind of took people's word for it. But they did have to bring in a form and show that they had done the 35 hours and certain job contacts, but it wasn't like verified. Yeah.
I'll say that I think that it is a little hard to interpret people's perception of how many hours they had received services. So sort of the direction makes sense, the numbers, I'm not sure. But I think in all of the individual components, you sort of see what the back to work folks recall receiving as opposed to the IJS folks. And I think in some ways that we found it a little bit more informative. But again, we'll see it also, I guess, in more detail soon.
Good morning. My name is Janine Boyce, and I work for Delaware's Division of Social Services. I'm the TANF Policy Administrator, and I'm just curious to know the cost between the two programs, the administering costs, because it seems like the results were very similar. So could you just give us a number?
Right, so that's an interesting question. So in practice, in practice for the pilot itself, there really wasn't a difference in cost. Our contractors were paid on 100% performance-based contracts. They were paid for completing the employment plans that I mentioned, but that's more than that. They were paid for job placement and retention outcomes. So if they could document a job place, and we ran this program through the providers where they were the ones managing both of them. So just for the IJS folks, just as for the back to work folks, if they could document an employment placement and then they could document the retention there, they got the same payment, regardless of which model the folks were served in. I think conceptually, we imagine independent job search to be less costly in terms of less hours in, so that you could have, for example, a provider serving a larger caseload if they're seeing that caseload less, right? If they're coming in less and they're taking up less seats and less computers and less staff time. So I think in thinking about a mix of services to serve our clients going forward, we imagine this as an option that does require less resources, but there wasn't a per se cost difference here.
Yeah, we've been thinking a lot about the costs, and I think, the back to work program, I think theoretically is more expensive, although it does result in benefit reductions. So, those could outweigh each other. That's why I kind of mentioned a benefit cost study. And one thing I also wanted to say about the IJS group and the services I got, I think, and that does have a cost, obviously, but I think if you did IJS in another setting where, like, it wasn't at these vendors where they had 1,000 things going on, that if you really came in once a week and there wasn't anything there, you would have a much cheaper program, and you'd probably have an IJS group that did a lot less. I mean, part of it was just the accessibility of those services was easy. You raised the transportation question. I mean, it was, you were kind of had to go there anyway. So I think that was part of the story of New York City, and just if you were to replicate it, I don't think you could really replicate that accessibility or maybe you could, but it's just a factor to consider.
So we're getting the stop sign from the front. So join me in thanking the panel. I invite those of you who are still asking questions to come up and talk.